Good afternoon, friends. My name is Eli Sachs. I'm the director of the program in Jewish Studies at the University of Colorado Boulder, and it's my pleasure to welcome you to the second program in our two-part Israel-Palestine webinar series, Plague and Quarantine, Past and Present. As some of you have heard me say before, we're very proud here at CU Boulder to be the home of the first endowed chair in Israel/Palestine studies anywhere in North America. We're excited. There's actually now a second, and so we're sort of thrilled that this has become a trend that we've helped launch. And we're really excited about the types of conversations and the types of learning and the type of exploration that this position makes possible. I just want to thank the Department of History for partnering with us on this initiative and today's program. We're very grateful. So today, in the second part of this series, we're going to have the opportunity for a conversation with Professor Weeam Hammoudeh of the Institute of Community and Public Health at Birzeit University about the topic, The End of the Tunnel is Dark, Reflections on the COVID-19 Pandemic Under Occupation. And momentarily, I'll turn things over to my friend and colleague, Professor Hilary Kalsman, our endowed Israel/Palestine Studies Chair, to introduce Professor Hammoudeh. First, though, a word about the kind of learning community that we're going to be creating this afternoon. So we really see this webinar as a space for conversation. And this is going to take three forms. So first, after Professor Hammoudeh presents for about 25 to 30 minutes, she and Professor Kalsman will be in conversation with one another. Second, after that, we want to open things up for a genuine discussion, not just between Professor Kalsman and Professor Hammoudeh, but also between all of you and Professor Hammoudeh. And you can participate in that conversation via the Q&A function at the bottom of your screen. So it should say somewhere towards the bottom of your all-powerful Zoom window, Q&A. And if you click on that, you can write in a question, and it will be visible to us. And we'll share it with Professor Hammoudeh and the group, and she'll respond. And you don't need to wait to the end of the program for that. You can start adding those questions as they occur to you during the presentation. And finally, we want this to be an opportunity for a conversation not just between Professor Kalsman and Professor Hammoudeh, and not even just between all of you and Professor Hammoudeh, but also an opportunity for conversations between you and your fellow participants. So if you click on that chat function at the bottom of your page, you can write a comment to the group as a whole. Just make sure that you're addressing it to all panelists and all attendees. I see that many of you are doing this. As Professor Kalsman offers her introduction, I really want to encourage all of you to introduce yourself to the group, to say who you are, where you're from, and why you decided to participate this afternoon. We are a community of learning. And community is built through these kinds of connections. During the presentation itself, we'll turn off that chat function, but we'll open it up again at the end. Okay, so none of you are here this afternoon to hear me. So I now want to turn things over to my friend and colleague, Hilary Kalsman, an assistant professor of history and our endowed professor of Israel/Palestine studies here at CU Boulder.
Thank you, Professor Sachs. I'm so excited to be able to introduce Professor Hammoudeh. So she's an assistant professor at the Institute of Community and Public Health at Birzeit in Ramallah, where she teaches in the Masters of Public Health program, and she's also the coordination of their mental health unit. She has a PhD and an MA in sociology from Brown University, where I got my BA, and a master's in public health from Birzeit. Her work looks at the political and social transformations, how these affect health, psychosocial well-being, and population processes, particularly in conflict areas, as well as how health systems and social institutions develop and shift in relation to political, economic, and structural factors. So right now she's working on a range of research projects, looking at the health of adolescent refugee girls, deprivation and mental health, uncertainty, and the sort of preparedness of the health system in the COVID response. So again, I'm so excited to hear her talk, and I'm going to turn it over to her now. And then I will be asking her some questions after her talk, and then we'll open it up. And I will be able to relay your questions to her.
Thank you, Professor Kalsman and Professor Sachs, and thank you for having me here today. Just got the presentation up. And thank you all for actually joining us today. So just a little bit of an overview before I actually begin the presentation. So like you can guess from the title, the focus of the presentation will be on the experience of the pandemic under occupation. And I'll be drawing on a mix of things. I'll be drawing on research that's ongoing that I had actually started before COVID began, looking at uncertainty, and then we had actually decided to continue doing this work to also look at how some of the chronic and maybe structural uncertainty that Palestinians face actually manifests itself in this global moment of uncertainty due to the pandemic. But I'll also be drawing on news reports and some statistics from other sources, just to give a sense of what the lived experience has been like. And I'll be giving probably like a more general overview, but again, if you want to know more about any specific dimension, please ask questions during the Q&A. Okay, so just as a bit of background, just so that we're on the same page. So thinking about, and like I said, this work also began actually before COVID, but then we had continued it to look more specifically at how COVID affected the situation. And it's just to say that if we're talking about the occupied Palestinian territory, this is the territory that was occupied by Israel in 1967. And it includes the West Bank and Gaza, including East Jerusalem. East Jerusalem was then annexed illegally by international law, but it was annexed by Israel shortly after. So this occupation has been ongoing, despite there being despite the signing of the Oslo Peace Accords and the presence of the Palestinian Authority, which was meant to be an interim government that was eventually supposed to have to be responsible for a separate or an independent state in the West Bank and Gaza within a 10-year period, and that was which should have been about 15 years ago. The occupation is not only prolonged, it's ongoing, and what that means is that there's also been ongoing confiscation of land. The agreement itself also divided Palestinian areas into areas A, B, and C, which have implications in terms of the kind of sovereignty that the Palestinian Authority can actually have. So areas A, which constitute about 20% of land, include mainly urban centers, and that's where the Palestinian Authority has control over civil and security issues in theory. And then areas B, which is roughly another 20%, and that's where the Palestinian Authority has control over civil issues, but not security matters. And then C, Israel still has control over both of those things. And area C constitutes about 60% of land, and most of it is, it's also where a lot of the agricultural lands are. This kind of geopolitical fragmentation has been, it manifests itself in terms of the administrative divisions of land, but then also a series of checkpoints, roadblocks, and other, and the wall, which physically separate areas from one another, and ever expanding settlements, which now, in the West Bank alone, there are close to maybe 600,000 settlers. And in light of the ongoing occupation and like other challenges to the system, we were generally starting off with weakened institutions, partly, big part in due to the occupation, but also because of political division that heightened in 2006, 2007 between Fatah and Hamas. And that also includes a weakened health system that was that's under-resourced and in a very weak position to handle a large crisis. There's also a captive economy that's very dependent on Israel. There's very high unemployment, which stands out at around 25% in the West Bank and Gaza. It's higher in Gaza with over 40%, and it's also much higher among young people and recent graduates. So political conditions have been deteriorating. Living conditions in Gaza, especially since the blockade that's been going on for more than 12 years at this point, have led to very dire conditions with various calls from different UN agencies to try to remedy this, but the situation remains where Gaza is under blockade and that with very, very strict restrictions on what can go in and out, including materials and people. So this is sort of the baseline that we were starting off with before COVID. And then we had this global moment where the pandemic happened. And initially, initially, it's just like being here, we were hearing more about it in the news, and especially like hearing about cases in Europe, and particularly in Italy, and so. But it seemed like something that was more distant. But then we had our first confirmed cases in the beginning of March, and they were linked. Okay, that's missing. So they were linked to tourists that were visiting Bethlehem, and then. Immediately after those cases so they were people that interacted with tourists that were visiting, and immediately afterwards, Bethlehem was sealed off, and then there was a strict lockdown that was instituted in the West Bank, and also various measures that were taken in Gaza, including completely quarantining anybody coming through the Rafah entry point, which was the only entry point at that into the Gaza Strip. Schools, universities, and places where large gatherings take place were completely closed off. So when this decision was made, it was a Thursday, and by Monday, we basically had to figure out how to go online at the university. So everything happened very quickly. With very strict health protocols put into place. And then I think one thing to also mention, then there was also an opening of communication channels between the government and the general public. So what happened afterwards was also there was a daily press conference that happened actually twice a day. And it was one of the few instances or spaces that had been created for this kind of exchange with the public, and where the official government spokesperson also responded to people's questions on social media and other, and then also to journalists. It was, so here, and I think what I'd like to mention is that the very strict measures that were taken place I think surprised people to an extent, but then the justification was that we have a very weak and fragmented health system that would be unable to cope with the types of emergencies that we were seeing in Italy, in the UK, in New York. And so the best course of action, or the only viable course of action at that point, was seen as taking very strict preventative measures. And this was one of the, and this was actually a decision that was supported by various agencies, including the WHO, and the Palestinian Ministry of Health's response was held up by the WHO as being exemplar of responses that were happening globally. And it was seen as one of those, and one of the reasons why cases were kept to a minimum. And these are just some pictures from various sources, so you can see sort of what that started to look like visually. You saw city centers completely being closed, completely empty, whereas they're usually very vibrant. There was a lot of emphasis on PPE, like in other places, and trying to get as much of the necessities that were in place. There was this whole issue of whether there were enough ventilators and ICU beds and all these other things that many countries, or all countries at this point, were worried about. But here there was this added layer of being under occupation also means that you don't have control over borders and what comes in and out, and then also being a very aid dependent government meant that like a lot of this also depended on donations from other countries or organizations. But there was a concerted effort to actually scale up some of the, to scale up resources for health. And there was, and very quickly, we also saw community mobilization trying to remedy some of the gaps, and there were different attempts to even, build ventilators to try to cover some of the needs in case we weren't able to actually get them from outside. And various local organizations were also activated to try to respond to the pandemic and to try to limit the disease from spreading. And a lot of this was also captured on media, and it was discussed very often. And it was, the 2 time slots for the press release were time slots that people actually stuck to and really watched. So everybody was really just worried about this pandemic. There was also like a lot that wasn't known about the virus, and that was a source of worry for a lot of people that we had talked to. And they also talked about how, their whole life at that moment changed. So one of our participants mentioned almost everything in life changed, everything, honestly. Work was affected, the economic situation was affected, social situation was affected. And it trapped everyone at home and made one believe the idea that the world could be turned upside down. So there was this sense that, everything flipped completely upside down. Nothing was the same, and they also didn't really know how long it would last. And in the beginning, people were expecting this to maybe be for about a month or 2 at most. Another woman who was also a nurse at one of the hospitals in Bethlehem, and it was one of the first places that was actually used as a testing center. She described the experience as it's like someone wanting to go down a path and they don't know what is there. Is it a well, the sea, a ditch? Are there beasts? Is there a forest? Walking on a path and not knowing what there will be after this closure or block in the road. There is a small opening that we'll pass through, but towards what will we find tomorrow? And this uncertainty was something that was actually experienced globally, and people also drew on that global experience in terms of, not being alone in this experience, but then at the same time having to deal with some unusual or quite unique circumstances, just given the political context. And so people constantly referred back to being under occupation and the role of occupation and disease. As the quote here says, we're under the authority of the occupation, even with disease. And so this was one of those situations where you expect that in a pandemic, some of the restrictions related to occupation, some of the, even some of the conflict in the political realm might be put on hold for a bit for the sake of the health response. But very early on, it was made clear that, the restrictions on getting things in and out meant that there were very significant delays in getting PPE in and getting testing kits. We were dealing with very few testing kits, and then they were increased incrementally. And I'll talk about this a little bit later, but at some points there was a shortage in testing kits, and that was one of the reasons why the Ministry of Health was also unable to track the situation in a way that would have allowed them to know that that a new outbreak was actually happening. And so this was one of the areas that where these things manifested themselves very clearly. And it was one of the areas where this issue of limited sovereignty comes up quite a bit. And some of the measures that were, some of the protocols and measures that were enforced by the Ministry of Health were also were not implemented in the way that they were put in, due to this limited sovereignty, and that goes back to also the limited sovereignty depending on how lands were classified, as I had mentioned earlier. And in the beginning of the pandemic, there was still coordination between the Palestinian Authority and the Israeli government. So some of this eventually took place, but it took time for it to actually take place. And as we know, in dealing with any contagious disease, a swift response is actually necessary. So people really brought up this whole issue of limited sovereignty. And so when respondent says the fear is that we don't have any guarantee, we don't have authority over our own borders. Another one also clarified there's no control. So consequently, at any moment, our measures throughout this period will fall apart. There was a time where they prevented the entry of alcohol in these materials, and they even prevented handover of tax funds, and all of this affects people's abilities to face the pandemic. The PA, the Palestinian Authority, is not allowed to reach Jerusalem areas because of the occupation. They're not allowed to let them enter. They're not allowing them to enter or to take on the role of supervising the response. And this was specifically referring to East Jerusalem. And very early on, we were hearing stories from Palestinians in East Jerusalem that they were being neglected, and some local initiatives were also stopped by Israeli police, and then what they were saying was at the same time no additional help was actually being provided at that time. And I think it's even worth noting that some of this kind of discrimination was also noted within even among Palestinian citizens of Israel, who actually created a campaign at that time, because a lot of even the informational materials were only in Hebrew and not in Arabic. In the Arab towns, there were delays in also setting up testing centers and other things. So this was something on people's minds. They expressed, at this point, people were very happy that the Palestinian Authority was taking things seriously and acting quickly, but at the same time, they were worried about the ramifications of this limited sovereignty and the impact that it would have. And so the other, and I want to turn to another angle here, which has to do with both the health response and the economic situation. And like I mentioned earlier, you know, in the West Bank and Gaza, and more specifically the West Bank, given the restrictions on movement for Gazans, it's really a captive economy with what's been termed an elastic labor force, which means that there are lots of Palestinians that depend on work in Israel. And at this point, when the Palestinian Authority acted fairly quickly, we had very few cases in the West Bank and even fewer cases in Gaza. But at the same time, there were very high numbers of cases in Israel, and measures were taken a lot more slowly. And I think part of it is because there were institutions that could handle this, so they didn't need to go into an immediate lockdown. But this also affected the health response. So one of the key areas that started coming out was this whole issue of workers that were working in Israel being exposed to the virus, and then coming back home, and what implications that actually has for the health situation in the West Bank. And here, this is another area where we also see the issue of the Palestinian Authority's ability to govern. So initially, the Prime Minister had mentioned that there had been an agreement between the Palestinian Authority and the Israeli government that employers would provide housing to workers, so they just stayed overnight rather than coming back and forth and potentially exposing people to the virus that was more prevalent in Israel. But that didn't actually come to be. And we're talking about large numbers, and there are different estimates putting it at between 80,000 to about 160,000 workers. And a lot of them work in construction and agriculture, and also some of them in the service industry. And what people were noting was that at this time, even like certain checkpoints that were usually more difficult were left unmanned. And so What happened was there was a lot of fear because of these workers, and initially, other than the cases that were linked to the tourists that visited Bethlehem and then the people that interacted with them, and then the spread that happened that way, most of the cases at this point were linked to workers, and it reached about 80%. And despite that agreement initially being being in place, what actually happened was very different. So towards the end of March, the 24th and the 25th, there were cases of Palestinian workers that were thrown at checkpoints by their Israeli employers or by the Israeli police. And these were documented by various agencies because they had a fever and they were worried that they had the virus. So in the moment that they were that they were suspected of actually being ill was when they were no longer welcome or given any sort of protection. And this gives you a sense of just the vulnerability that some of these workers live under because they don't have insurance. They depend on daily wages rather than employment with real tax benefits. And so this created a lot of even more fear and worry. And that was when the Palestinian Authority and in coordination also started implementing stricter measures. So they kept insisting and then reached an agreement with Israeli employers that they would provide housing. They also placed checkpoints in areas that they were able to control near locations where there were other checkpoints. And this was actually very tricky because it's you're used to a checkpoint being from the occupying force. It's very tricky terrain. And what they tried to do was also, they called these checkpoints of love and tried to reinforce this idea that this was, for people's well-being, and it was because we're trying to minimize the spread of this virus. And so you saw and this became a common sight that we saw, where workers were urged, I guess, to uphold, to adhere to protocol. They were also urged to minimize their movement and also go into quarantine immediately after they came back, just in case. And this appeased people's worries to an extent, but then one of the issues that really increased people's worries again was when the first case of death actually took place. And this was a woman who was in her 50s, whose son was a worker in Israel. And this was how she was reported to have contracted COVID, and it was a few days after she had surgery. So again, this became the center of a lot of public debate. And it also, one of the participants that we had spoken to also talked about the stigma that came along with it. So people were, so these workers found themselves in a situation where they had to make a choice between health and income. And a lot of them basically chose to continue working because they needed to provide for their families. And one of them even had told us, at the end of the day, I would rather die of COVID than have my family die of starvation. So these were the kinds of calculations or choices that people had to make in very difficult circumstances. And then another angle or vignette that I want to actually look at is, so in all of the health responses and the guidelines, there's an emphasis on hygiene, there's an emphasis on, having shelter, you need to be able to isolate. And so there was another agreement that there would be no home demolitions taking place during the pandemic. And these are demolitions that, take place fairly regularly, sometimes home demolitions, sometimes others. And this has to do with the way that land is categorized and also the ability of Palestinians to actually get building permits. And so what happened, especially in areas in the Jordan Valley, was these demolitions continued to take place. And as one of our participants from the Jordan Valley mentioned, so he raises this question: did the occupation forget about annexation of land? Sadly, no. Did the occupation leave its plans regarding lands and Palestinian citizen? Unfortunately, no. People are still martyred, and annexation is present, and the annexation of the Jordan Valley in the near future, unfortunately. Demolition of homes. We are in the middle of the emergency, and demolitions of Palestinian homes in Diuk Tahta, which is the village that he's from in the Jordan Valley, is taking place. And according to the Office for the Coordination of Humanitarian Affairs, since the pandemic began, at least 471 structures have been demolished by the Israeli military, and that includes at least 46 homes, and which has displaced 300 people, despite this agreement with the Israeli military that no demolitions would be taking place. So this is another one of those things where even if you're trying to implement or adhere to guidelines, the actual infrastructure that allows you to do that is put at risk, and especially in areas that are seen to be at greater risk of annexation. And this is one of the moments where also the looming, or I should say de jure annexation was on people's minds. And it was in a few months before COVID was also when Trump announced his peace plan, which also just includes a lot more further annexation of Palestinian lands and threats to livelihoods. And people couldn't really separate those two. And sometimes they would talk about how, in the grand scheme of things, the political might actually be a lot more dangerous than what we were potentially facing with the pandemic. And another, and so here we can see how these things intersect. So you have the health response. So you have a Ministry of Health that's actually trying, even with limited capacity, even with various mistakes that were made. But you also have the occupation affecting infrastructure and livelihoods, which we know, even from a public health perspective, are very important for any sort of, for health states and health conditions. And then and you see that the occupation affecting the economic and then also affecting the Palestinian Authority's ability to govern. And some people even talked about, there being these porous borders that were suddenly left open to allow for this kind of, for people to go in, knowing that there were dire economic consequences of lockdown, and also because the Israeli economy also depends to an extent on these Palestinian day workers or elastic labor force. And one respondent actually also talks about this intersection. So he's talking about somebody that he knew in one of these areas where there's very limited jurisdiction. And he says, no food, no money, no one asked about them. What is the citizen thinking as he's sitting at home? He thinks they should provide him a bite of food for his children. And here he's referring to the Palestinian Authority's responsibility towards people. Throughout Ramadan, which is the month of fasting, someone was eating only lentils. No one looked at me, thought of me, he said, until the man got out of his dignity, so this translates a little bit funny, but it's kind of like he put his dignity aside. And he said, you people stand with me. I and my children ate lentils all Ramadan. So he basically had to say, to acknowledge that he was facing very dire economic situations. He lost everything. The place he was working stopped working. His boss told him to sit at home, and the government, which said the work will send 50% of the salary, was only talk, ink on paper without action. The factories were most affected in the balad, which is our town. And the workers who are daily paid were also harmed because there is no building. The balad stagnated. We have, for example, the Kufr Aqab area, which is actually area seen but classified as being part of Jerusalem. So there's even more limited sovereignty there, affected a lot. Kufr Aqab is the only one that I do not know is under occupation or under the PA. I remember when there was a case in Kufr Aqab and the PA went to impose order, the Israeli army came and began to expel the PA. This area, they do not know if they're under occupation of the PA. The PA contained the disease, under occupation or the PA, not of. The PA contained the disease and fixed situations and treated cases in Area A. But areas B and C was under Israeli occupation, and the PA was not able to control control these areas, such as Kfar Aqab and Qalandia. We were negatively affected by occupation in the last period. And here he's also referring to the last period where the Palestinian Authority also stopped coordination because once Israel announced its plans to annex the Jordan Valley at the end of May. And so this made the situation even more pronounced. And this is what, it's one of these examples, and there are many others, where you don't really where you don't have jurisdiction, but even when you try to act for the, in order to step in for the well-being of the population, a lot of the times it's actually met with force from the Israeli military. But at the same time, even though this particular area, for example, is considered part of the Jerusalem municipality, the municipality doesn't really offer them any services, and they weren't included in any part of the response. So this gives you a sense of just, the degree of challenges and how the political overlaps with the economic and overlaps with the social, and overlaps also with issues around governance and the ability to act. But at the same time, and I think it's worth noting that this was also a time where there were community responses and collective action. And this was something that people talked about. Like, they talked about a notable increase in local initiatives. And this was after a period of demobilization, partly related with increased authoritarianism in the Palestinian Authority, but also ongoing repression of certain political groups by the Israeli occupation. And so people talked about these local initiatives. A lot of them were youth-led. Emergency committees were formed. These were a lot more common in rural areas and camps where people knew each other. They were smaller. But they weren't exclusively in these areas, but even like in urban areas, you had campaigns to collect donations, food packages were being delivered. And a lot of this was actually just, was organized through people who were not really linked to any political party or formal institution. And so this was, and people talked about this as being a source of hope and solidarity, because it reminded them of times in the past where these forms of social solidarity were a lot more prevalent. And especially when we were under more direct occupation, like before the Palestinian Authority came to be. And so one young woman told us, it reminds you that there's still good in people. And this was also one of the things that actually helped reduce some of her anxieties around what would happen because of the pandemic. And another woman who had been an activist in the 80s said, it gives me hope when I see young people organizing the way we used to during the first Intifada, hope for a better future. And I think for a lot of people, like, it's been, the past couple of years, like I mentioned, there's been a very dramatic deterioration in political circumstances, both due to the internal political divisions and due to occupation. And these forms of collective action really inspired people and gave them hope that things can potentially change for the better. People also drew on experiences with parallels with the past, and we saw this commonly with with people who are now maybe in their 40s, 50s, 60s, who had experiences during the first Palestinian uprising or Intifada, which is often described as like an uprising that depended a lot on grassroots mobilization, providing alternative services because the Israeli occupation was not actually providing these services to people. And they talked about other things that they had learned intergenerationally. And so they talked about something we call al-muna, which kind of refers to sort of like your stock of food or pantry. And it's this thing that's, it's not exclusive to Palestinians. You see it in other parts of the world, but where you're always supposed to have certain staples in the house in case of emergencies. And these include things like lentils, chickpeas, rice. And sometimes people would say, as long as we have like olive oil and flour and za'atar, at least like we can survive. And so this helped them cope with some of the more immediate economic effects, especially when they weren't able to buy foods in the same way. And this was something that they had learned through generations. And then the other issues, like I mentioned before, was the presence of collective solidarities and support networks, and these were activated. A lot of them were based within families, but then also within neighborhoods and villages or camps, and particularly in refugee camps. And there are 19 in the West Bank and an additional at least down in Gaza, you really saw these networks come together to provide for people. And so they provided things like food. Sometimes they also charged people's electricity. They also cooperated with health institutions to deliver medications for chronic disease patients so that they wouldn't go out without medication during the lockdown. And there was also quick activation of local committees, like I mentioned. On the other hand, and this was one side that people stressed in terms of these modes of coping that they had learned through generations or had experienced firsthand. But also on the other hand, some people, especially people who had actually lived through the first uprising, talked about how, yeah, some of these things are taking place, but then at the same time, we're living in a very different context. So it's a more fragmented social fabric, and that is also linked to the geopolitical context, where people are also more physically separated from one another, and that affects relations. The economic policies that have been instituted, especially in the last 15 years or so, have really pushed more neoliberal agendas that also affect people's abilities to absorb economic shocks. So more people are in debt than they've ever been. And there were lots of worries around being able to make payments to banks for loans, mortgages, and whatnot. And then the internal political split. So they saw these things, coexisting, sometimes at odds with each other, but then at the same time, really trying to hold on to the possibility of these collective solidarities as being a way to move forward. And I think it's worth noting, so like I mentioned earlier, people were happy with the way that the government was responding because they saw them as acting swiftly, as prioritizing people's health over other issues like economy. But at the same time, especially as the lockdown continued, because from the beginning of the lockdown, it was not really clear how long it would be in place for. Like, a state of emergency was initially called for a 1-month period, and it's been extended on a monthly basis since then. And as I mentioned earlier, there are weak government institutions. So, so there were few social protection mechanisms that affected people's abilities to actually withstand the lockdown and being out of work. And a recently published data by the Palestinian Central Bureau of Statistics notes that 42% of families reported that there was at least a 50% reduction in their income during this lockdown period. So this is, large by any measure, and these economic concerns became very heightened. And at the same time, the government had promised to start these funds that would be used to try to cover some of these new needs and try to prevent some of what they were calling the potentially new poor, but they weren't able to meet needs. And then there were also stories of corruption or lack of transparency in how disbursements took place. And at the same time, it was also the communication channels that I had mentioned earlier that really also helped increase confidence were abruptly stopped once the lockdown ended at the end of May. And then there's the broader political context, and at that point, it was really just like the looming de jure annexation that made people wonder whether the pandemic was actually potentially going to be used for political ends. And so, and in thinking about how this actually affected, so this is from the period of March until the end of May, and if we're looking at the cases per day, we're talking about a fairly controlled situation. So like the worst hit areas at this point were East Jerusalem, and then Jerusalem suburbs, which are the areas outside of the wall where the Palestinian Authority can at least enter to an extent. But I mean, it wasn't a very large caseload. In most cases were not very severe. None of the I think like none of the new ventilators actually had to be used for any of them. The ICU beds were not really used as often as they had suspected based on estimates that were coming in based from global projections. So at the end of lockdown, it was a pretty controlled health situation. After lockdown, and especially with these economic concerns and this growing distrust and continuing occupation, that's when things kind of fell apart. So we went from a situation where things were fairly controlled to a situation where we had one of the highest increases in incidence of COVID cases in the world. And so ending the lockdown, there were maybe around, if we go back here, roughly, under 800 cases. Currently, we are at over 60,000 cases for a population of about 5 million. So this is quite substantial. And this was when people, and because we were doing these interviews throughout these different phases, but this was also when you really saw the criticism of the government and the response becoming a lot more apparent. And so when one person who actually works in the health system mentioned it, referring to the pandemic, revealed our lack of preparedness for something less than a pandemic, not the pandemic itself, the lack of preparedness for certain facets of daily life. I felt that the authority reached the point of being lost, meaning that it no longer knows what to do, from economics to health of people. Okay, but the authority has been here for 27 years, the Ministry of Health for 27 years. Why is it at the first real challenge we have become vulnerable? Where were they? Why were there no basic preparations? Lots of things you don't have the basic requirements for. These basic needs should have been taken into account in their preparations and providing services. I noticed there was a kind of dishonesty when they would say things were moving fine. I felt that Corona exposed complete sectors in the state and its preparedness. And here I think it's also worth noting that if we go back to this chart over here and you see June, it's still very limited cases, and then you see like a very sudden spike. And most accounts actually put this as not necessarily a new outbreak, but rather it was a period where they were out of testing kits but didn't acknowledge that, and then it was once they were able to get new testing kits and start testing, then many new hotspots were discovered. And so this is one of those things that could have been discovered much earlier had there been a system that would have been able to procure its needs in a timely fashion. And so the situation that we're left with right now is we have close to 63,000 confirmed cases with COVID. Most of those have recovered, so it's about 88% have recovered. 40 are currently in critical condition. There have been 525 deaths to date. And what we also saw was Gaza, which initially had the situation under control because they were controlling the border areas from Rafah. New outbreaks occurred because they weren't able to actually control the limited movement from areas that had that actually resulted in new outbreaks. So from a very controlled situation to a not controlled situation, and then I just want to end on, thinking about. In a lot of the interviews, people kind of used this metaphor of the tunnel and the end of the tunnel being dark, and indicating that there's a lot that's still unknown. And on one side, so you still see people that are, are very worried about what that end of the tunnel would actually look like. So they'll say, so one person said, I can describe it as a crisis on top of a crisis for the Palestinian people. The crisis of the ongoing situation from long ago, the situation of the Palestinian people, in addition to the issue of Corona. And another said we have two epidemics, a chronic disease, which is the occupation, and corona, which has come to Palestine and the rest of the world. But we are unique in our experience of occupation. And so here, again, they're drawing on both the global, but then the local specificity. But at the same time, you saw people thinking of this as a potential opportunity for change, because it has kind of laid bare that the status quo is not going to be sustainable in the future. And so one person mentioned, I have a lot of confidence, certainty in people, that we as a people will overcome this challenge because we have overcome tons of challenges. And another mentioned, as a society, we will be able to overcome this issue through a form of real solidarity. And it is very important that it is far from propaganda. So in both of these, we also see that they're drawing on this idea of the collective and this insistence that real forms of solidarities that are far from the political propaganda that we've been hearing are really our potential for change. And so what you do see is, while the situation does look very abysmal, but at the same time, for some people, it's an opportunity to both reflect inwards and then continue to demand justice. And some people also refer to, where it referred to global movements that have been taking place along the lines of social and political inequalities, and drawing attention to the root causes of these inequities that have become more apparent with COVID. And I think, and for some people, this was also an opportunity to continue and push towards that call for an end to occupation and justice, while at the same time inward looking and calling for a different kind of political, economic, and social system. Thank you for being with us and listening.
Weeam, I want to thank you for that presentation. I think I'm only going to ask maybe one or two questions, and then audience members, if you would like to ask a question, please post them in the Q&A. So one of the things I wanted to ask is kind of what drew you to, particularly the subject of uncertainty, because I know that was something in your research, even before COVID, and then how did COVID kind of affect your research questions and trajectory?
I think it was based on years of doing research, and this is not just me personally, but also a lot of the people that I work with that are part of the larger research team, and thinking through how people's lived experiences of, stemming from the political, social and economic context affect their lives and also affect health. And this is something that you see in the mental health literature specifically. But at the same time, it's often, one of my mentors and colleagues also refers to it as they focus on what's between the head, what's between the ears. And so it's made to be this individual issue. It's made to be oh, it's because you're just unsure of yourself, you're lacking confidence, and it becomes this very individualized way of then dealing with it. And I think, living here and working here, you realize you can't separate yourself from this broader context, and you see how it actually affects, very minute details of life, from even registering your children, applications for even family reunification, other things that are supposed to be very basic. And so we had started this work, and we had started out as a small qualitative study to try to understand that lived experience more and to try to understand how it affects people's lives. And we had just finished the initial part of data collection, I think at the end of January, and we were analyzing these interviews after they were transcribed, and then COVID happened. So we decided that it was actually really important to then go back and try to understand, okay, now in this moment, what are people doing? How are they surviving? How are they coping? And so we actually started by going back to some of the same people that we had interviewed in the first round, and then some new people. And we did all of these interviews either by phone or Zoom or other, just given the lockdown and measures. And what we also noticed was that in these interviews, it was much easier for people to talk because it was also, and some of them even took, like, considered it like a form of venting and a way for them to even just process what was happening to them, because it was a very concrete experience that they were dealing with.
And then I wanted to ask, so taking one audience question, can you like talk a little bit about how the sort of experience in COVID in the occupied Palestinian territories differed from that in like other Middle Eastern countries and in Israel? Like, what do you think is sort of unique to like this occupation situation versus other countries in the region?
Okay. I mean, one of the comparisons I think I can draw is Jordan, which is, which borders the West Bank. And so you have, similar population structure, also, in terms of like economic conditions, very similar living standards and things like that. But this is where you saw how important it was to actually have a government that was able to implement its decisions, and how important it was to be able to control your borders and to and bring in the equipment that you need. So for example, if you compare like the number of tests that have been done here compared to Jordan, they're actually about a quarter of those done in Jordan, whereas the cases in Jordan are a quarter of the cases that we have. And so this is just one example. I think in other countries in the region, like if you compare, I mean, the higher income countries were able to deal with some of the social protection issues in a way that we couldn't, but also, for example, countries like Jordan and Lebanon couldn't either. Compared to Israel, you saw these differences in terms of just the infrastructure, the institutions, the ability of government to actually exert sovereignty and implement its decisions. Those were very clear. So the economic concerns, while they were there, but were not as dire in terms of their effects.
And I was wondering if you could also speak a bit more about the sort of like issue of sovereignty within the different areas in the West Bank. So how did the fact that like, one area is completely under Israeli control and one isn't, how did that affect like people's day-to-day lives with COVID, not just in terms of like, can the Palestinian Ministry of Health get, sort of in there, but how did that affect people's socializing with COVID as well?
Yeah, so this was one of the things, and I didn't really get into it earlier, but this was one of the things that came out very clearly when there were restrictions put on large gatherings, where they were like basically banning large gatherings in rural, like in all areas, so to speak. And I think around the same period where you see these spikes, and it was partly people's frustrations, and it had lasted longer than they wanted to, and there were things that they weren't willing to actually give up, like having weddings and funerals and other gatherings, and also religious gatherings. And so in these areas, in some of these areas, life continued as if there was no pandemic, and people, and there was no way to actually stop that from happening without, and you saw very clearly these hotspots. So I mentioned earlier that in the first period, 80% of cases were related to workers that were working in Israel. Right now, 80% of cases are actually go back to these large gatherings, like either weddings and funerals and things like that. And then it also affects other things like the ability to even have testing properly set up, and a monitoring of the situation, and having people adhere to these things.
And then I have one other audience question, which is the pandemic sort of teaching like the PA or sort of governments a lesson about like dependence on foreign aid? Like, is it working? Are they trying to look for, sort of other options? Is there anything the government's doing differently in the context of the pandemic to try to like lessen reliance on foreign aid? Or has foreign aid actually been like, sort of sufficient or enough in this instance?
So in this instance, initially they had tried to garner more support from the private sector. And I think they were expecting the private sector to step in more than they actually did. So there were donations a bit earlier, but I think but you have also the private sector that was that was hard hit by the economic restrictions that were taking place. I can't say that the government has actually started doing things differently. I think there is a realization that they're kind of stuck, but the problem is, so in the past couple of years, there's been an implementation of these more neoliberal policies that have effects on people's abilities to cope, but then at the same time, you don't actually have an economy with sovereignty. So it's a captive economy, and it creates like a very deformed economic structure. And so there's a dependence on this elastic workforce in Israel, and there's a dependence on aid. And with very little control also over borders, I don't see that situation changing. With one of the things that's actually being proposed right now is thinking about a different kind of tax structure, a different kind of economic policies that are within the Palestinian Authority's purview of changing, like taxing businesses more to try to cover some of these things. Thinking more seriously about some kind of mandatory social security system that people pay into. But I think one of the key things that also needs to change is people need to trust that they'll be able to do this. And right now they haven't proven that to be the case. In terms of aid, there is a cluster that was put together to respond, and it's a combination of local and international organizations. And so there's a response plan that was first published, I think, end of March, beginning of April, and then it was updated in August. And there are the different sectors, including like health, social protection, education. So it's still short. It's about maybe 60% or so has been covered, and it varies quite a bit depending on sector. And so one of the areas that's received the least amount of support, for example, is education. Whereas food security is more supported, but none of them have actually reached 100% of need.
And this is, so I think I'm going to take one more question, which is asking, have you been able to compare this situation to actually like countries that are also struggling with issues of sovereignty? So like Kashmir, or actually even like First Nations, Native American reservations in North America, where they weren't able to close their borders because they can't control their own borders.
Yeah, so we haven't actually done these comparisons like in a systematic manner, but these were things that like we've discussed and we've been thinking about. And I think there are a lot of parallels in terms of what we're seeing. And that's why I had mentioned earlier that there are global movements around these issues that are increasing awareness around them, and I think it's really important to be part of that conversation. And I think one of the things that the pandemic itself has actually reminded people is that especially in the globalized world that we live in, like we really do need to think about things both locally and globally, and really link up with these movements. And those parallels are clear in theory. It's hard to sometimes compare because also data availability is an issue. In Kashmir, for example, it's very hard to actually get any numbers about what's happening, and there's been a block on media access. Yeah.
Well, again, I think I like this sort of ending on the, okay, in this globalized world, we need to figure out sort of better connections. Again, I also want to say like, thank you for also like allowing us to sort of be connected to you and what is going on there, you know, far away in like snowy, freezing Boulder as well. I want to thank some people who helped put together this lecture series. And then I think Eli is going to talk a little bit about some upcoming events we have as well. So again, I would like to thank the CU Boulder Endowed Chair of Israel-Palestine Studies, which not only has given me this job, but also is allowing us to put on this kind of programming and to invite speakers to talk on these really relevant issues. I'd like to thank the History Department for sponsoring. I'd like to thank Daniel, who's been running everything so smoothly in the background. I'd like to thank Linda Park, who's the program manager for Jewish Studies and who has also helped really publicize the event. And finally, I'd like to thank Danya and Eyal Rivlin, who composed and performed the song we heard at the opening of the program.
Thank you so much. Excuse me, Professor Kalsman, and really thank you so much, Professor Hammoudeh, for this presentation. We learned a tremendous amount, and I want to echo Professor Kalsman in sort of thanking you for the opportunity to have this kind of global connection to think about these issues. I want to first of all just mention a few other programs that we in the program in Jewish Studies have coming up. This is of course the talk we had today, and this is one of our important series, our Israel-Palestine webinar series, but we have several other series that we run as well. One of our kind of signature series is something we call our Peak to Peak series, which is a series of, it's a kind of partnership between our program on the one hand and CU Boulder's Office of Outreach and Engagement and a number of civic organizations across Colorado, creative arts districts, local libraries, local museums, Jewish communal organizations, where we create conversations between faculty members from CU Boulder and members of local communities. We have two coming up this fall. Professor Kalsman will be in a conversation called Exams and Extremis, Standardized Testing, Politics and Crisis in the Middle East. That will be on Thursday, November 19th. And then on Monday, December 14th, our colleague, Professor Yonatan Malin in the College of Music, will be giving a presentation on the topic Klezmer Music as Jewish Dialogue and Jewish Discourse. So we hope to see all of you at those programs, and we'll have more programs to roll out in the spring, more peak-to-peak webinars, also a series of programs on race and Jewish studies about which we're very excited. And finally, we thanked Professor Hammoudeh earlier, we thanked Professor Kalsman, and I want to conclude by thanking all of you for taking the time to be here today. We throw around the word community a lot in academic circles, but we really try to take that seriously here at Boulder. We really see ourselves as a community of diverse individuals coming together to think, learn, and grow with one another. I know that you have many Zoom options these days. There's also a lot going on in the world right now, to say the least, and we're really honored that you took the time to not just be a part of, but really to create this community. With that, I'm going to open up the chat again. Anyone who wishes to do so, I encourage you to share some parting thoughts with the group, and we look forward to seeing you at future programs.